الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. This is made by Professor Hani, Vaccine Administration. Key issues: basic principles of vaccine administration techniques, communication, recommended vaccine administration routes, appropriate injection sites and needle size, standard precautions, pain control measures, traumatic care for children, preparation, positioning, positive reinforcement, communication. Discuss vaccines indicated on this visit, use of vaccine information leaflets, identify any precautions or contraindications, encourage questions, address concerns, inform about next immunization due date. Importance of administration vaccines correctly. Ensure optimal vaccine efficacy. For example, upper outer quarter of buttocks is not a recommended site for any of vaccine routinely given due to significant layer of fat, possible danger to sciatic nerve, decreased immunogenicity of hepatitis B vaccine if given in gluteus maximus. Again, what is the importance of correct vaccine administration? Decrease localized systemic reaction. In general, vaccine containing adjuvants like DT, TD, hepatitis B or hepatitis A should be injected into muscle mass because when given subcutaneously, it will lead to local irritation, inflammation, and even granuloma formation. Also, correct administration decrease pain. This through use right side of needle. The correct route of administration. This is the intramuscular at left. This is in the middle subcutaneous. In the right intradermal. Intramuscular must travel through subcutaneous tissue. Subcutaneous do not reach muscle. Intradermal in the skin do not go to the subcutaneous tissue either. Routes of administration. It is important to use correct route when giving vaccines. Insert needle at appropriate angle to ensure delivery to muscle or subcutaneous tissue, so there is little local neural, vascular, or tissue injury. Intramuscular. Angle of needle is perpendicular to skin so certain muscle is reached. Introduce needle with a quick thrust. دفعة سريعة. Quick thrust. Retain pressure on skin around injection site with a thumb and index fingers of the other hand for entire time needle is inserted. During injection, retain pressure on skin around injection site. Pressure with thumb and index fingers of the other hand if you are injecting with your right hand. With index fingers of the other hand, you make pressure for entire time of injection. Needle is inserted. Subcutaneous. The angle of needle insertion is 45 degrees to skin. Press up a bit of subcutaneous tissue with other hand may help in preventing inadvertent intramuscular injection. So for subcutaneous, the angle of needle insertion is 45 degrees. Press up a bit of subcutaneous tissue with other hand may help prevent inadvertent intramuscular injection. Choice of site and needle size based upon age, volume of material, viscosity of material, size of muscle, recommended depth. Recommended vaccine administration routes. This is given in each insert for each vaccine package. Here are some summary of most important ones. Subcutaneous for MMR, IPV, inactivated polio, pneumococcal polysaccharide, varicella. These are subcutaneous. Intramuscular, diphtheria, DTaP, DT, TD, hepatitis B, HIV, influenza, IPV, pneumococcal polysaccharide, pneumococcal conjugate, hepatitis A. Intramuscular injections, infant and toddler. Age, infant between 0 to 12 months, toddler more than 12 to 36 months. Site, vastus lateralis, needle size 7 by 8. 7 by 8, which is 1 inch. Gauge 22 to 25. Intramuscular for infants and toddlers. Generally, for intramuscular injection, needle should be long enough to reach muscle mass, prevent vaccine from seeping into subcutaneous tissue, but not so long as to injure underlying neurovascular structures and bone. What sites are correct for intramuscular injections for infants? Infants from birth till 12 months, vastus lateralis in anterolateral aspect of middle or upper thigh used for infants. What size needle is appropriate for them? If 5 by 8 needle may be used, but after that 7 by 8. As for recommended gauge of needle, 22 to 25 gauge. A 22 gauge is really big lumen for most vaccines, and a 23 would be okay, less painful. Intramuscular injections for toddlers, children, and adults. For toddlers more than 36 months, children and adults, needle size 1 inches. Toddlers and children 1 to 2. Assess weight. Children, adolescents, and adults. That is to say, you must consider weight. Gauge 22 to 25, and these are the places for injection. Here 3 thumbs, then this is the point where you use for injection. Here, this is the place. Subcutaneous injections for infants and toddlers. Infants, as we said before, at outer aspect of thigh, the needle 5 by 8 to 3 by 4, and the gauge is 23 to 25 toddlers in the upper R. Here is the toddler, upper R. Subcutaneous injections for children and adults. As we said before, this is the place for injection, and this is the place for subcutaneous. Two sites for subcutaneous. Standard precautions. Gloves not required but may be indicated. Do not recap used needles or separate needle and syringe. Discard syringe and needle in a puncture-proof sharp container and discard container correctly. Follow rules and legislation for needle stick safety prevention. Multiple injections. When necessary, 2 or more vaccines may be given in the same limb. Distance for separating 2 injections should be sufficient, 2 to 3 cm apart, so that local reactions are unlikely to develop. Consider possibility of local reactions when choosing sites. Do not mix multiple vaccines in a single syringe unless specifically licensed for this. You must read it in the insert for the vaccine. Preparation, why we need it, what to expect, define expectations, your job, assess what has worked in past, team approach, invite parents, plan for focusing techniques like deep breathing, storytelling, identify what you will do to decrease pain. Positioning for comfort, close physical contact with parent or caregiver. Caregiver participates in positive assistance, not negative restraining. Sitting positioning promotes sense of control for child. Immobility of extremity is successful. Fewer people needed to perform procedure. This is an example of how to make the child comfort. The physician, the mother, and another nurse. The nurse and the mother, and the child is hugging his mother. Positive reinforcement. Point out when they are doing their job. Verbal praise. Rewards. Don't forget to say, I am sorry, and remind positive of why procedure is needed. This is to be done to positive reinforcement. Positioning. Intramuscular, position limb to allow relaxation of muscle injected. Deltoid, flex arm, anterolateral thigh, some degree of internal rotation. Infants and young children hold securely in parent's lap. Older children sit on parent's lap or edge of examination table and hug parent's chest. Adolescents and adults should be seated for immunization. This is example. Here, the child with the nurse and the mother and another nurse. Tips for working with children. Never rush in. on a child. Be polite, respect his rights. Begin with mood of child and work from there. Warn children when painful procedures are to be done. Get on his eye level. Never tease or ridicule. يعني لا تغيظ ولا تسخر. Laugh with him, not at him. Do not put a premium on being big. Hugs help a lot. Offer choices only when choices are possible. Be truthful. Comforting the child. Parents are the best source of comfort, so encourage them. Little things mean a lot. Band-aids work. Praise, praise, praise. شجعهم باستمرار. وفي النهاية شكرا والحمد لله.